Some of the other research that we're doing is we're obviously electronic cigarettes, e-cigarettes are an important product that's hit the market in the past decade. So one of the things we're doing is we're just finishing up a study that's a national survey of physicians looking at the communication they have with patients around e-cigarettes. And we're finding that a lot of physicians are reporting that their patients are asking them about e-cigarettes, and about a third of physicians are recommending e-cigarettes for their patients to help them quit smoking. Some of the other things that we just found out more recently in a third wave of this survey is that there's a lot of misperceptions around nicotine itself. So people think about nicotine in terms of its harm as nicotine being this dangerous chemical. In fact, nicotine, although being the addictive chemical in tobacco smoke, all of the health issues that we worry about with smoking, cancer, heart disease, emphysema, none of those are related to nicotine. But there's a lot of misperception. So in the general public, a lot of people think that nicotine is as harmful as cigarette smoking. And even among physicians, we found that as many as 80% of physicians misperceive the risks of nicotine and think that nicotine itself is related to things like cancer and heart disease. So there's a lot of educational information that we need to get out there, both to the general population as well as to physicians about the harms of nicotine. When you smoke, there's 7,000 known toxins in tobacco smoke. Nicotine is one of those 7,000 chemicals. And although nicotine is by far the most addictive chemical in tobacco smoke, nicotine itself doesn't cause cancer, doesn't cause heart disease, doesn't cause lung disease, but it's what keeps you smoking. So it's the 6,999 other chemicals in tobacco smoke that does most of the damage to the body.